Aboriginal and Torres Strait Islander viewers are advised that the following video may contain images and voices of people who have passed away.
So with me we've got Jenny Tyrrell and Michelle Druitt, who were to be with us here in Wagga Wagga today, but unfortunately are housebound because of extreme fire danger and not allowed to leave the company. So we have you on video conference, and that's just the nature of rural health, isn't it? Improvising and changing on a daily basis. So welcome.
Thank you, Jenny.
Rural Health Network at ACI is one of the newer networks at ACI, and it has a few roles which have evolved over the 3 years that we've been in existence. First and foremost, it was around casting a rural lens, a rural perspective across models of care that were being developed out of ACI. Secondly, it was to actually look at identifying and showcasing innovative practice that's happening across the LHDs. And the third main priority was around working up ground-up priorities, so identifying issues that really needed attention and then forming up working parties and meeting the needs of the local health districts by meeting the needs of those priorities. The Rural Health Network has actually achieved quite a bit in its short life of 3 years. Last year we actually finished a very valuable piece of work, which was the New South Wales Telehealth Guidelines, which creates a standardised toolkit for people who want to start up telehealth consultations, but also to use telehealth to link clinicians for educational activities. Rural communities are very, very good at being innovative because they have smaller staffing ratios and fewer resources to work with, so they have to improvise often. They have to wear many hats, so they have to be able to juggle different and competing priorities very well. So quite often we see innovation being born out of absolute desperation because something needs to be done. It works. It works because they have engagement from the clinicians and from the managers right from the word go. So Jenny, can you tell me more about telehealth and the New South Wales Telehealth Guidelines that you referred to? We're using telehealth more and more, aren't we, in rural health?
Most definitely, and we were using telehealth right now to do this interview, which is all very exciting. With telehealth, there's lots of reasons we can't release staff, so using telehealth is imperative for rural sites to be able to link and to be active in so many different ways. But with any new or emerging technology, there needs to be some standardised practices. And so what the Telehealth Working Party were doing, were putting together a whole series of information within one guideline to help influence that correct governance, checklists, patient information handouts. It was all brought together into the one guideline to help influence our best practice around the use of telehealth. So it was a very exciting initiative and really well received by all the LHDs.
I'm seeing a lot more information come across my desk in the way of what programs are running out there, what ideas are happening in other rural areas that we may not have here. And when you actually take part in something like ACI, you realise that what you're doing here in the local level is what's happening on a state level, and if we all bring it together and share ideas, then we've got to have better outcomes for our people.
It's really important that rural people have a say about what's happening to influence policy and to influence the guidelines that are being developed around care. It's the lived experience, it's the distance from the nearest centre, it's the lack of access to internet and mobile phone coverage. It's the issues they have leaving home and leaving country to access specialist care. It's really important that their voice is heard when all these factors are on the table and the model of care is being developed, to ensure that we're not wasting everyone's time by developing models that simply won't fit and won't meet the need.
The rural matrix come out of the Rural Network Executive Group, in that we wanted to have a checklist or guideline that allowed anyone developing up a new model of care or a new guideline for statewide purposes, that they took on board any considerations for rural health that might need to be considered when developing up a new model of care, because obviously rural and metropolitan are very, very different in the way they operate, and it was about highlighting some of those differences.
The Rural Health Network are currently working on a model of care for multipurpose services, and in particular for residents who live within those multipurpose services, around living well in an MPS. It's around quality of life, it's about independence, it's about leisure activities, and it's about food and nutrition. There are 60 multipurpose services around New South Wales at the moment, and these are the old district hospitals that have actually been transitioned into multipurpose services, where they have an acute department, they have an emergency department, they have a community health centre, and they also have residential aged care. And they've been a wonderful asset and a wonderful model for rural communities, where older people can actually stay in their communities in residential care without having to leave to get the care they need. So we're doing quite a bit of work around that at the moment, because they are a hospital, they look after acute patients, but they are residents' home, and there's 400 people who call MPS home right now living in New South Wales MPSs. So the work that we're doing is around a model of care to improve the quality of life for those residents who live in care. At the end of the day, we will have a toolkit of principles that people can actually draw on to actually increase the quality of life for the residents that they're caring for. So I'm interested to hear from both of you around Murrumbidgee's involvement with the Rich Forum.
It came out of a need to do this, to connect rural clinicians and showcase the innovations across New South Wales. And a lot of these local sites, because healthcare is changing so rapidly, a lot of the models of care are changing, a lot of the practices are changing. And so what we found was that to link people up, and so that they could hear the innovations that were occurring across New South Wales and share and collaborate and adopt or adapt to local needs these innovations, it was a really good way of running a conference without having all the travel associated.
Yeah, I think one of the major evaluation pieces that came out was that the clinicians really valued the opportunity to connect locally but network statewide without having to leave the workplace, and without having to find backfill relief, because they could just pop in for sessions that were relevant but not have to be there for the whole day like you do when you go to a conventional forum.
I think everybody working in health is in it for the reasons of actually caring for their community and making improvements. And a great way of doing it is actually network with other people. Everyone's sort of working in the same space. We're all sort of forging in the same direction, and the best way of doing that is to work collectively and collaboratively and actually achieve the outcomes that we're working towards. So rather than sit out there in LHD land and work in isolation, let's get on board and work together, and we can achieve a lot more than we would do independently.
I feel now that we have a much stronger voice as a result of ACI and the Rural Health Network becoming active. We're being accepted now by the local health districts. The more we hear of those definitive episodes, the better it is, and we'll be able to improve the health and the delivery of health to rural people.
I think the Rural Health Network has a lot of potential benefits for patients and carers. Initially, there's a connection between clinicians of all areas, so that there's always learning opportunities, and those learning opportunities directly feed back to how we deliver our care. And I think there's a great opportunity to actually work the other way, so have patients and carers are actively involved in our Rural Health Network, in our Rural Health Project initiatives, and so we can escalate, making sure that all our innovations actually build in the capacity to improve things for patients and carers.
The Rural Health Network welcomes members anytime. There are different ways in which you can become involved in the Rural Health Network. You can be involved as a member on the distribution list, and you can receive information, newsletters, scholarship opportunities, workshop and education opportunities, and have opportunity to feed back. Or you can actually register an expression of interest to come onto one of the working parties if we're developing a model of care or developing a priority from the ground up. or you can actually nominate to be on the executive committee if you really are passionate about making a change and want to join the leadership and governance of the Rural Health Network.